NICU stands for a Newborn Intensive Care Unit. This is a nursery in a hospital that provides around the clock care to assist sick or premature babies. It has healthcare providers who have special training and equipment rather to give your baby the best possible care. Counselling Psychologist and the chairperson of the Gauteng Association of Infant Mental Health, Nicole Canin, joins me to tell us more about NICU. Good morning, Nicole, and thank you for joining me.
Hi, thank you for having me.
It is a pleasure. Now, NICU, or can we call it NICU? What is
Yeah, that's easier.
what is the purpose of NICU, neonatal intensive care units?
So look, I think that the neonatal ICU's primary function is
Mm,
really to keep alive and to treat medically infants that have been born prematurely. And what's interesting is there have been a lot of technological advances, and it means that younger and younger babies that are born sooner and sooner are now viable medically. In other words, they can keep babies even now kind of 24, 25 weeks, which was kind of unfathomable, a
mm,
few years ago. They can keep them alive medically.
wow.
And so the main focus of the neonatal ICU is what do they need to provide, whether it's breathing, ventilation, how can they keep these babies alive so that they can grow and develop. So that is the kind of main medical reason for the neonatal ICU. But of course,
Mhm.
there's a whole other dimension, which is psychologically, emotionally, what happens to babies in the neonatal ICU, and what do we need to be taking into account in that regard as well?
Yeah, because when you are the chairperson of the Gauteng Association of Infant Mental Health, when you put those words together, it's like, do infants actually get mental health? And you try to understand the infant mental health. So please help us understand what infant mental health is.
Look, we could have a whole morning just on that topic, but I'll be kind of just brief. Infant mental health is the field that basically looks at what happens in the first year, kind of 3 years, but really essentially the starting point is the year, and how that sets up all the kind of processes and neurological structures and templates, should we say, for emotional and psychological health that really sets us up for the rest of our lives. So we know that what happens during the first year really matters. And I think that if you think about a place like the neonatal ICU, it's so hard when we're trying to just keep babies alive. We're just trying to help them make it through, to think and hold in mind that, in fact, even tiny babies need connection, need to be thought of as humans, not as medical, not what their medical conditions are, not what their needs are. And I think that when we think about it in the context of the neonatal ICU, what we're saying is, what happens in that time and how we soothe and talk to and interact with babies, even in the neonatal ICU, where that seems like such a strange concept, and it seems like it would be the last thing we need to be thinking about, actually is incredibly important, because we know that it does have an impact on their mental health and on what happens developmentally, really also for the rest of their lives. So it's something we need to be talking about.
All right. Now, when are babies taken to the neonatal ICU?
Well, it will be from birth. I mean, I guess the neonatal ICU really isn't only for premature babies, although having worked in a few neonatal ICUs, predominantly that's what we see. Of
Mm-hmm.
any kind of very young baby that needs hospitalization for whatever reason can land up in the Nicu, but certainly the main thrust is going to be your premature, and so then really it's from birth, unless a baby kind of gets sick. Um, but you can imagine it's quite a traumatic place. Mothers who've had difficult, often very traumatic births, babies that are now separated from them, who are hooked up to all kinds of equipment. There's a real stress around, is my baby going to make it? Is the baby going to survive? Lots of health challenges. And so what we're talking about, which is, how do we interact with babies? How do we help them to feel that their needs for connection, and what we found through research is that even very premature babies need to connect. They want to connect. and it's actually pretty critical for their mental health that they do, that in fact it matters, even though, of course, it is a place of life and death, and we have to acknowledge extreme trauma.
All right, now take us through the process. How do they connect, and how can parents connect with them?
Well, perhaps let's just start by saying it's a place where it is very hard to connect.
Mm,
And we have to acknowledge that. Firstly, parents in the neonatal ICU are generally very stressed. They're traumatized. They're worried about the viability of their babies. They're worried. And also remember, they've lost their role. You know, parents, they haven't been able to take their baby home and take on the normal role of taking care of all the things that facilitate bonding. So that's on the one side. On the other side, you have babies. Premature babies in the neonatal ICU have a much lower threshold of stress. They're much harder to connect with. They often don't open their eyes for very long during the day. It can feel very hard to kind of say, well, how am I going to connect with my baby? How am I going to kind of even interact? There are all these machines that are hooked up. And I guess the first thing that I would say is parents need to recognize that they need to take care of themselves, their own mental health. They have to get support during this time. That's, I guess, the kind of first step. The second thing, I think, is just to start with the notion that, in fact, even such a tiny baby can be connected with, can be interacted with. And, you know, during my time of working in the neonatal ICU, what we found is even very small, subtle things like moms talking to their babies while they're having quite invasive procedures like having blood drawn, moms who do kangaroo care, just that time of having your baby strapped to you for kind of periods during the day, taking on as much of a kind of parental role as is possible given your baby's medical situation. All those kinds of things are incredibly important. And I think that as kind of medical professionals, we have to be encouraging parents to take on a role, explaining that they are what they do, their voice, talking to babies, interacting with them, any kind of cuddle time that's possible. All of that is very, very important, as is, I think, that parents have to be helped to recognize their baby's distress signals so that they're almost helping their babies they're learning how to soothe and calm even a tiny baby who gets stressed quickly, who gets upset and irritated quite quickly. Parents have to be really helped to understand all those kinds of things, which then makes connecting, getting to know, and interacting with their babies just that little bit easier.
All right, and I'd like to know what happens when there is no connection, when parents aren't able to connect with their babies. But let us take a quick break, and we'll continue when we return.
Like Tib Black Seed. You can find Tib Black Seed at all leading pharmacies or find out more at blackseed.co.za.
Approximately 785 million people in this world do not have access to safe, clean water. In developing countries, around 80% of all illnesses are due to contaminated water and poor sanitation. Don't let dirty water end a life. Build a water well in Bangladesh, Malawi, Nepal, Zimbabwe, or here at home in South Africa. Donate to Penny Appeal's Thirst Relief Project to bring safe, clean water to communities around the world. www.pennyappeal.org.za or call 031 1100 573. Penny Appeal. Small change, big difference.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and freezer card calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
Sustain, sacrifice, share.
Africa.
This Eid al-Adha, donate your Udhiyah Qurbani to Africa Muslims Agency. We ensure that your Qurbani not only feeds the poor, but creates sustainable incomes for local farmers, brings the practice of sacrifice to the villages, and shares the spirit of Eid. Sponsor in South Africa for 2,650 rands. Africa, 1,650 rands. Palestine, 7,250 rands per share. Or in Lebanon, Afghanistan, and other countries across the globe. Visit africamuslimsagency.co.za for pricing and to donate. Call Africa Muslims Agency now on 011 834 8685. Africa Muslims Agency, commemorating 35 years of empowering, educating, inspiring.
Breaking stereotypes, moving boundaries, joining hands. Salam Media.
لا تقل لوحدي أو كيف السبيل.
Humanity sets the agenda.
11:19, you are listening to the Mid-Morning Talk on Salam Media, and we are talking about neonatal ICU, how parents can help connect and care for their babies in a neonatal ICU. And one of the tips that guest Nicole Canin has mentioned is that parents need to take care of themselves. You know, it is a stressful and difficult time, but if there's one thing that you can do is to first look after yourself so that you are in the right mind space and you're able to connect properly with your child. But what happens when you cannot connect with your child? Nicole, thank you for staying on the line. And exactly that. What happens when you cannot connect with your child? What are the chances of survival, or rather the baby growing up to have a positive mental health?
Look, I always try to be very careful when answering these kinds of questions, because I think parents with a baby in the neonatal ICU have enormous stresses already. You know, just in terms of worrying about their baby's outcome, many parents worry what's going to happen in the future. So the last thing that I want to do is load that. So perhaps we can look at it in a slightly different way and say, what we've seen, what I've observed clinically and what the research is showing, is that what happens is babies that are offered in the neonatal ICU times in which they are soothed, calmed, and where they don't always have to manage what are often very painful and invasive medical procedures on their own, often clinically do better. But that's just something that's just something that I've seen, or that I've observed, should I say. But I think that what's important is those babies learn that they can rely on others to soothe and comfort them, even in times of enormous stress. And what happens is, we know that you know, when you experience that kind of pain, when you experience those kinds of stressful situations, cortisol levels go up at a time when we know our stress response systems in the brain are being laid down. And so what we know is that when parents are able to even minimally talk to their baby, soothe and calm them, hold them to them, offer them that kind of comfort, it reduces cortisol levels, it supports brain development, and it facilitates that kind of growth. Now, that's not always possible, and we know and we recognize that. And so sometimes what we know is parents then take home a much more fussy baby, a baby that has a kind of a much lower threshold of what's going to trigger that stress response. But here's what's also important to say is we know that the brain is very kind of neuroplastic, we say. And parents can make up for that. It just becomes much harder. And so I would say to those parents who aren't able to offer anything in the neonatal ICU, who've been prevented from doing that for all kinds of reasons, you can make better. But my advice would be seek help in doing that, so that over time, we know that the brain is plastic, and parents can then help those babies to develop ways in helping themselves, learning how to soothe, how to calm down those high cortisol levels and stress levels. I would rather explain it like that, rather than giving parents another thing to get incredibly stressed about and worried about, if that makes sense.
Mm-hmm. All right. Now, as a counseling psychologist, how do you help parents?
I think that the biggest thing is helping parents to pick up on cues. Term babies that are born healthier, babies that perhaps have an easier disposition, it's much easier to notice when they're starting to get a bit stressed, when they need to be removed, and then it's also much easier to calm and soothe them. With premature babies, those signals are often much, much more subtle. Things like tremors, things like yawns. Those are very, very subtle cues that your baby is now not coping as well. And also what we know with premature babies is they go from being kind of seemingly calm to often being in a state of real distress very, very quickly. So the more that we can help parents to make sense of, hang on, what am I seeing? How do I make sense of this baby that I now need to take care of? And then it's so much more helpful for those parents to offer the kind of support that is going to be developmentally helpful. The other thing is, I'm always very worried. It's exactly what you referred to earlier. I'm very worried about the state of mind of that parent. I'm also kind of watching for that to see what kind of support does the parent need. Because exactly as you said, a parent that is traumatized, a parent that is depressed, which we know is often the case, and then a parent that is highly anxious is going to find parenting a premature baby that much harder. And so a part of my role is also to kind of say, okay, what do I need to offer you? How can we address your needs so that you are then much more available to your baby, much more able to parent what is a much harder baby to parent?
And then obviously that will also increase the risk of developing postnatal stress disorder for the parents, etc. Right now, what is the state of neonatal ICU in South Africa, especially in the public hospitals?
It's interesting that actually I've worked in both public and in private neonatal ICUs, and actually sometimes in the being a psychologist, I don't want to talk from a medical perspective, but often in the public hospitals, parents sometimes have much more access to their babies, much more opportunities very often to take care, to be involved in the day-to-day parenting. I think sometimes in private hospitals where the medical care may be slightly technologically more advanced, but sometimes there are many more blocks to be, being accessible, being available, time limits, visiting hours, etc. And so I guess for me, the one message that I would like to put out there for doctors and professionals is it needs to be as accessible as possible for parents to have access to their babies, obviously without compromising their kind of medical conditions.
All right. And what are your final thoughts and advice? I mean, this is a topic we could go on and on about, but with time, unfortunately, we can't.
I guess just to say to parents that if you have a premature baby, it's to recognize that your baby has gone through a very traumatic, regardless of what the condition is. I would say one of the things that is a given, a traumatic kind of entrance into the world. And so have you. It's a very hard way to become a parent. It's a very difficult, process. And to be very gentle on yourself and to reach out for whatever support is available to you to say, how can I help myself? And how can I help myself to know my baby? Because I think very often we don't think of premature babies as babies. They kind of they're this condition, this is what's needed. And I guess for me, it's to just change our thinking to say, this is a baby that needs you to talk to them, that needs you to connect with them. And perhaps get whatever support you can to do just that.
All right. Thank you so much for your time, Nicole, and for sharing that with us. I hope our parents have gotten a different perspective when it comes to neonatal ICU. It's not something that is often spoken of. So yeah, it's good to raise awareness about the alternative care that is available. Thank you once again, and have a wonderful day.
You too. Bye.
All right. That was Nicole Canin. She's a counseling psychologist and the chairperson of the Gauteng Association of Infant Mental Health. If you need to know more about neonatal intensive care units or neonatal ICU, you can go to the Gauteng Association of Infant Mental Health. You can Google them. And it's very important to be in the right mental health as a parent so that you're able to help your infant, your baby, your premature child who is in the NICU. And, you know, if you are stressed, obviously that stress you will carry that stress with you, and you won't be able to connect optimally the way that you want to connect with your child. So it's also great to have a good support structure, a good support system, so that when you do go there, and you have the right people on your side as well, whether it's a family member, your partner, a doula, whomever. Just make sure that you get a good support system as well. It is 11:28. You are listening to the Mid Morning Talk on Salam Media. We will be right back.